Senator Conrad gives his opening remarks on his health insurance reform bill at a town hall meeting in Center, North Dakota on August 20, 2009. In this portion of the remarks, Conrad explains that he will not vote for a bill that includes abortion, health care for illegal immigrants, a government takeover of health care, or includes end-of-life counseling.
Let me make just a couple of other comments as well. First of all, as I've said all across North Dakota, and this is an answer to one of your questions, Royal, I will not support a bill that has a government takeover of health insurance. I don't think that would be wise. Frankly, the government's got all it can handle right now, and I don't think running healthcare delivery would be something that should be added. Number two, I will not support a bill that funds abortion. We have the Hyde Amendment that precludes the federal government from funding abortion. I've been a long-time supporter of the Hyde Amendment out of respect to many of our fellow citizens who, as a matter of conscience, would not want their tax dollars used in that way. Third, I will not support a bill that provides coverage to people who are here illegally. The last thing we need is another inducement for people to come here. We already have a serious problem of people coming here illegally. Fourth, I will not support a bill that mandates end-of-life counseling. Let me just say, none of the current proposals does that, despite what you may have read, and despite the fact that I would not vote for these other proposals. The fact is there is no mandatory end-of-life counseling. And I'd also say to you, I've just gone through with my sister-in-law, who just passed away 3 weeks ago of ovarian cancer. The end-of-life counseling was very, very valuable to her husband and to her children. But that shouldn't be a mandatory matter. That's between the family and the doctors.
But when confronted by an audience member who explains that those statements do not apply to the current health care legislation, Senator Conrad confirms that they indeed do not apply to the health care legislation. He simply adds that to each meeting, because the audience continues to be afraid that these are included in the legislation.
Those questions, because this is the 25th of these meetings I've done. Those are the questions that I get over and over. And I found if I answer them on the front end, that allows people to get to the next level of questions. So I try to be clear. It is true that some of those provisions are not in some of the options. That is true. But these are the questions that come to me repeatedly in these forums. So I try to answer them on the front end.
Senator Conrad, it is time to stop campaigning to the conservative base, and to tell North Dakota voters that simply none of these wild and false claims are in the health insurance legislation. By campaigning, instead of informing the public, North Dakota voters continue to be confused. Stop campaigning, Senator, and support the public option.